The Ministry of Health, Wellness and Elderly Affairs, in collaboration with the United Nations Population Fund, UNFPA, recently hosted a capacity building training workshop on the clinical management of rape and sexually transmitted infections, STIs, under the Build Back Equal project funded by Global Affairs Canada. The training brought together St. Lucia's frontline clinical staff with the objective of enhancing their ability to provide comprehensive care for survivors of rape and other forms of gender-based violence. Participants were also equipped with advanced skills in managing sexually transmitted infections, ensuring a more patient-centered and holistic approach to sexual and reproductive health care. During her opening remarks, the Senior Medical Officer in the Ministry of Health, Wellness and Elderly Affairs, Dr. Gail Kajada, underscored the importance of continuously upgrading the clinical capacity of healthcare professionals.
Improving and updating clinical knowledge and management will allow for better integration of services offered to communities, especially in a polyclinic setting, thus reducing the burden on the hospital emergency services. Prior to the BBE project, UNFPA conducted the Minimal Initial Service Package Training, MISP, for reproductive health in crisis situations such as natural disasters, sudden population displacement, etc. As part of that training, there was a Trainer of Trainers workshop on the clinical management of rape and response to survivors of intimate partner violence in Guyana in 2023. And I mention this because the 3 days of the CMR workshop this week will be building further upon this.
Deputy Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Ernest Nobal, noted that sexual assault often results in serious health consequences, such as sexually transmitted infections, and emphasized that the workshops will strengthen the ministry's ability to respond to and support survivors.
Sexual assault is one form of gender-based violence, and sexually transmitted infections can occur in the aftermath of these assaults. These workshops will increase and improve the capacity of the Ministry of Health, Wellness and Elderly Affairs to respond and to manage affected persons. The Ministry of Health, Wellness and Elderly Affairs is grateful for the opportunities that have been provided and continue to be provided through the funding by Global Affairs Canada and the collaboration of UNFPA and UN Women under the umbrella of the Build Back Equal project.
In addition to the training, the initiative also included a handover of essential sexual and reproductive health (SRH) commodities from UNFPA to the Ministry of Health. The supplies were funded by the Build Back Equal project and Global Affairs Canada. These supplies will strengthen the ministry's capacity to deliver critical SRH services, particularly for vulnerable groups, as part of broader efforts to improve access, quality, and responsiveness in sexual and reproductive health. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Unika McCoy reporting.